My name is Dr. Michelle Collins Ogle, and I'm the medical director of the Northern Outreach Clinic in Henderson, North Carolina. It's actually been 20 years that I've been in infectious disease in the world of HIV. So my experience began in Detroit, Michigan, at Children's Hospital in Michigan, which is where I was doing my infectious diseases residency, fellowship and my pediatric residency at the time. And we were seeing babies in the hospital being hospitalized with this disease we called HTLV3, and these babies were dying. Often the babies' mothers were very ill and not able to take care of them, and they often didn't have relatives to take care of them, so they became our babies, so to speak. So we would have young children, infants in the hospital for months, and they became our babies. And my experience was, of course, at that time, the only drug we had available to give them to treat them was AZT. These babies became very ill. They didn't live past a couple years, and I actually would hold those babies and let them die right in my arms. And I made a commitment then to continue to take care of people infected with HIV and to stay in this battle and be supportive of trying to eradicate HIV infection in children and adolescents.
How long have you been here in Henderson?
For 10 years.
And explain to me what it is like to practice the kind of medicine you practice here. How many patients do you have? What are the issues you're having with the patients? Where do they come from? Social, ethnic background.
Our patients are primarily lower income. They are poorly educated.
What do you call poorly educated?
Most of my patients do not have a high school degree. Most of my patients cannot read beyond the 8th grade. They don't have a fundamental understanding of what's going on with them in this disease. They rely on hearsay. They rely on antiquated information, think that once they're infected with HIV, they're going to die. So oftentimes people come ready to die and not really wanting to fight the disease. And then so my job is to turn that around and let them know that they will live and they can live, and to help them fight the disease. They have years of people not caring about them. So they look at the medical system as a system that's not there for them because they're poor. They often have had physicians who've never touched them, doctors. So when I examine them, it's a bomb for us because they thank me for not being afraid to touch them. So we have quite a huge undertaking taking care of the population in rural North Carolina.
Have you seen a change in who gets infected over the years?
Yes.
This started as a male gay disease.
Well, and I have some disagreement with that. Mm-hmm. The gay white males were the first poster children for HIV, and that's primarily because they were the ones making the noise about HIV infected in their community or in their population. At the same time, there was all this noise about HIV being a gay white male disease. I was taking care of black babies that were infected with this virus, whose mothers were infected with this virus and either dying or dead, whose fathers were infected with this virus and dying or dead. Most of these people that I'm referring to, the commonality for them was drugs. And in the urban areas in the 80s is when we really saw crack addiction as a major player in HIV. So we actually try to beg the community to not just label HIV as a gay white male disease, but this is an everybody disease. But unfortunately, what happened in the African American community, we didn't want to talk about it, and we kept it very hush-hush. It wasn't seen as so important because these were crack addicts. So they really weren't seen as people that were really important that we should care about. So in the meantime, the gay white males made the noise, brought attention to this virus, brought attention to this disease and how to try to prevent transmission. The best thing that happened for the African American community is when Irvin Johnson announced that he was HIV positive. Because then it put a black face, a known heterosexual male, on the map. And then it sort of opened up the conversation. It's still going towards more women being diagnosed, younger women being diagnosed. We have had lately a flood of young women, ages 19 to 24. We've seen an increase in that young demographic being infected with HIV.
Are they not hearing the message, or are they not caring?
I don't think that they're not caring. They're not receiving the message. And remember, we're in North Carolina. We're in rural North Carolina. We're in the Bible Belt. And other areas that need to be addressed are not being addressed. For example, safe sex. The abstinence-only programs have done more to hurt our cause than anything else I can think of. Abstinence-only programs are often not factual in the information that they provide youngsters. They also do not allow us to address appropriate condom use and to be safe when you have sex. And when we acknowledge that the government's own studies support the fact that abstinence-only programs don't work, the fact that we still have abstinence-only programs in any community, in any state, is criminal.